Okay, so good morning, everyone. My name is Thomas de Jong. I'm the Junior Policy Manager for Health Equity at the European Public Health Alliance. I'm also the coordinator for the Roma Health Network, for which we have organized this event today, in which we will be speaking about a policy paper that we have just released today. Now, if we can move on to the next slide, I would like to briefly just take you to through some points of interest before we get started. First off, please be aware that the event is being recorded. We want to disseminate at a later point so people can rewatch it afterwards as well. Also, if you have any questions that pop up during the event at any point during the presentation, the keynotes, or during the panel discussion, feel free to share them in the Q&A function. It's at the bottom of the screen. The link to the policy paper has also just been posted in the chat. We will also repost the link later on as well. If you're interested to read more in depth on the policy paper or the executive summary of the policy paper, you can find it in that link. If you're interested in the work of the Roma Health Network, or if you are perhaps interested in joining or know somebody else who would want to join, there's also a link to that in the chat. And then lastly, please also feel free to share posts about the event on social media. We have our Twitter handle on the screen right now, as well as these two hashtags, hashtag Roma Health and hashtag Health Inequalities, that you could use to sort of promote the event if you want to. So if we then move on to the next slide, I will just briefly introduce to you the Roma Health Network. So as the name implies, the Roma Health Network is a network of members that focus specifically on Roma health. It was jointly established by EPHA in 2018, and it consists of a number of Roma and pro-Roma civil society organizations, as well as independent researchers or researchers for universities, again, who focus specifically on Roma health issues or who do projects directly with Roma in communities on health. Currently, the network consists of about 20 organizations spread out over 10 countries in Europe, within and outside of the European Union. And the main activities of the network really focus on capacity building of pro-Roma and Roma civil society, and also on policy advocacy on the European level, but also to some degree on the national and local level. Now, if we can move on to the next slide, I would like to briefly take you through the structure of this event. So we will be speaking about the EU Roma Strategic Framework for Inclusion, Participation, until 2030. This is really the main policy instrument used by the European Commission to foster Roma inclusion. That's really what the event is about and what our policy paper is about. Now, to set the stage on this, first we will have two keynotes, one from Marcela Adamova, who works for the Directorate General of Justice and Consumers for the European Commission, as well as Romeo Franz, who is a member of European Parliament. After that, I will present to you the paper, the policy paper, Roma Health and Housing, Filling in the Gaps. And then after that, we will go more in depth on some of the topics of the paper in a panel discussion. We have Jaroslav Kling joining us from the Fundamental Rights Agency of the European Union. We have then also Daniel and Miranda of CESPID and Olga Theodorikakou from Klimaka, Greece, who are both members of the Roma Health Network, and we'll talk about some of their expertise. And then we have Kumar Vishwanathan joining us from the Ergo Network, who also works for Vzájemné soužití, or Life Together organization in Ostrava. And then after that, there will also be some, as I said, some room for questions. So if you have questions popping up during the event, feel free to share them in the Q&A function, and we will try to address them at the end of the event. We can then minimize the presentation now, and we can move on to our first speaker. So as I said, that's Marcela Adamova. She's a policy officer for the Non-Discrimination and Roma Coordination Unit at the Directorate General for Justice and Consumers, DG Just, at the European Commission. Now, aside from that, she also has extensive experience already in health mediation. She's worked on the Healthy Regions Initiative in Slovakia. She's worked for the NHS and Oxfam in the UK, and she's also, if I'm correct, the founder of the first Roma NGO in Glasgow, Romano Love. And she will set the stage for us on the EU Roma Strategic Framework. Now, thank you very much, Marcela, for joining us today. Feel free to get started with your keynote. Just to remind you, we have allocated around 10 minutes for it, but you've already indicated it will be a bit less. But yeah, without further ado, the floor is yours.
Thank you very much, Thomas, for this very nice introduction. Can you hear me? Can you see me?
Everything's fine. Yeah, go ahead.
Okay, so dear ladies and gentlemen, I am pleased to have this opportunity to be here with you today and to address the issue of health and housing inequalities facing by many Roma people in the EU. As Thomas already said, I come from Eastern Slovakia, and before joining the Commission, I used to work in the area of health mediation in the hospital environment, where I was specifically working at maternity and gynecology wards. There I have experienced some welcoming and understanding people doing their utmost to support all patients. But often I came across unequal and discriminatory treatment of Roma women and even segregated Roma rooms within these hospital wards. What struck me the most was that the situation was perceived by society as normal and justified. The situation I witnessed when working in the field of health mediation is not unique only for Eastern Slovakia. Social exclusion, extreme poverty, systemic discrimination, and anti-Gypsyism are part of everyday life of many Roma people also in Romania, Bulgaria, Hungary, and so on. A significant amount of EU funding has been available to address the dire conditions faced by marginalized Roma communities, but their situation has not improved, and in some cases, it even worsened. This was also confirmed by the latest survey, which was collected by the Fundamental Rights Agency. So, for example, 52% of Roma live in housing deprivation. Only 22% live in the households without tap water. And the Roma women live approximately 11 years less than the women in general population. In 2021, more Roma felt discriminated against when accessing health services than in 2016. 2 years ago, the European Commission adopted a reformed and reinforced EU Roma Strategic Framework for Equality, Inclusion and Participation, which defines the European Union and member states' policies in this area for the next 10 years. In this revised strategic framework, the Commission is focusing on 7 key areas. And these areas are equality, inclusion, participation, education, employment, health, and housing. The inclusion of clear targets for each of these areas is new and ambitious, but also clearly necessary to ensure progress towards this agenda. I will give you some examples. In our efforts, we want to reduce gap in housing deprivation by at least 1/3. We also ensure that at least 95% Roma have access to tap water. Or we are also heading to cut life expectancy gap between Roma and the general population by at least half. We also need to address discrimination and anti-Gypsyism systematically. And we urgently need to encourage Roma to report their experiences to the authorities. The member states have confirmed their commitment to tackling the issues the Roma are facing when adopting the Council recommendation on Roma equality, inclusion, and participation. In the national Roma strategic frameworks, member states should provide concrete measures to ensure equal treatment of Roma people in access to adequate desegregated housing and essential services, and effective equal access without barriers to quality health care, especially for those groups that are most at risk are those living in marginalized and remote localities. Ladies and gentlemen, I'm confident to say that the EU Roma Strategic Framework provides a good opportunity for enhancing Roma equality, inclusion, and participation. It also provides an opportunity to tackle discrimination and anti-Gypsyism and encourages member states to better address health and housing inequalities, including the COVID-19 impact in the deprived Roma communities. However, if we want to succeed, we must work strategically and we have to be committed at all levels. at the local, national, but also EU level. The Commission services are in the process of assessing the national Roma strategies that we received from the member states. The communication on the assessment of these national Roma strategic frameworks, together with the staff working document, will be published by the end of this year. The European Commission will further continue supporting member states in implementing the national Roma strategic frameworks and funding programs to effectively reach those Roma who are the most in need. We will also continue strengthening capacities of civil society organizations, increasing political determination and the meaningful participation of Roma themselves in this process. Later this month, the European Commission, together with the Czech presidency, is organizing the EU platform for Roma inclusion, which will take place in Prague, where stakeholders working at different levels and experts will meet to discuss how to better approach the issue concerning Roma equality, inclusion, and participation to achieve tangible changes. I believe that some of you will take part in this meeting. And now I wish you a fruitful discussion, and I'm looking forward to the feedback. Thank you very much for your attention.
Perfect. Thank you very much, Marcela, for that speech. You touched on a couple of points that I think are quite relevant here. Well, I mean, I think one of the most important things is you mentioned also participation of Roma themselves. This is obviously something that I think is very important to underline. But then aside from that, and this is also things that we will go into during this event today, the access barriers to health, the access to disaggregated housing. But I just want to take this opportunity to also thank the Roma unit very much for its proactive stance, and the fact that, as you mentioned yourself as well, that capacity building in civil society is very important. And that is why we are very thankful that not just us as EPHA and as the Roma Health Network are involved in your work on the EU Roma Framework and on the recommendations, but also other ones, and that we really see you as an ally, and that there's really this tension for the fact that civil society is also very important out of all those three levels. So thank you again for that. I just want to mention as well that unfortunately Marcela cannot stay for the entire event because of a very busy schedule. But again, we want to thank you very much for taking the time for this. Okay, done with that, we will move on to the second keynote. And for this keynote, we are joined by somebody from the European Parliament, as I said. So we are joined by Romeo Franz, who is a member of the European Parliament from Germany. He's active for the Greens and the European Free Alliance. He's himself of Sinti descent, and he's also one of the European Parliament's biggest champions for Roma inclusion, as well as a very close ally for those fighting for Roma rights. Now, unfortunately, his schedule did not allow him to join us directly today, but he's kindly agreed to record a message for us to set the stage. Now, this message of his will not just relate to the European Parliament parliamentary perspective. It will also focus very much on his personal perspective, on his experience in Germany, but also there will be some footage from a recent visit he had in Ukraine, where he visited some Roma communities, which are some very moving images. And that will really sort of also let us focus on another aspect that is very important, that are the people themselves that we are going to be talking about today. So without further ado, I would like to move on to this video now and to listen to what Mr. Franz has to say.
Dear ladies and gentlemen, dear friends, I would like to thank the European Public Health Alliance for organizing this conference and for giving me the opportunity to contribute to this very important topic on the situation of Romani people in the areas of health and housing. Indeed, the Romani people suffer from exclusion and anti-Gypsyism in these two most important areas of life. Their exclusion, though, has different forms and degrees across the European Union and beyond. In Germany, for instance, Romani people suffer discrimination when searching for housing to rent. In a case revealed last year in the city of Bremen, another worrying example was given evidence of the widespread structural and institutional racism. When the Municipal Housing Association systematically discriminated against Romani people by categorizing them and excluding them from any offers of apartments. Even 8 decades after the persecution of the minority by the National Socialists, Sinti and Roma continue to be disadvantaged in Germany. The same anti-Gypsyism in the majority societies is also the root cause for the situation of Romani people in Eastern countries such as Romania, Slovakia, but also in the Western Balkans or in the Ukraine. Most of the people of this largest ethnic minority in Europe live in segregated settlements in devastating living conditions. I have traveled to many of these settlements, and the circumstances how and where these people live are not only extremely precarious, but alarming. In particular, the situation of the most vulnerable, that of the children in these settlements, affected me badly. These children often do not even have proper clothes or shoes, have no warm meals, and face this misery on a daily basis with no perspective of improvement. In the Ukraine, in Lviv, I even met Romani people that live since decades in the woods with no shelter, with nothing. They are completely deprived from all fundamental rights. These living conditions are also affecting the health situation of those people living in settlements. Infant mortality is extremely high, and the life expectation much lower than that of the non-Romani majority. With no access to water and sanitary systems, with no access to health services, the COVID-19 pandemic had impacted Romani people harder than the non-Romani majority. On top of this, the pandemic gave rise to public scapegoating and hate speech against Romani people. And now, with the rising of energy prices and food prices, the rising of political tensions in our societies as a result of the Russian aggression against Ukraine, what will these developments cause for the Romani people? It is clear that we need to act more decisively, also because the current situation is not acceptable. Since 2011, we have the Roma strategy, numerous programs and initiatives that have been endowed with a lot of money to end these disadvantages and precarious living conditions of this marginalized ethnic minority. Unfortunately, the situation has de facto not improved over the years. And that, ladies and gentlemen, is unfortunately also a political defeat for the European Union. I do appreciate the true commitment of colleagues in the Parliament for their fight for real Romani inclusion. The good political will of the European Parliament that has adopted a resolution on the implementation of national Romani integration strategies in 2020, and recently the resolution on the situation of Romani people living in settlements in the EU with great majority. But unfortunately, all resolutions and Commission recommendations failed till now because they are not legally binding. They fail to be implemented in national, municipal and local levels. The funds are not arriving where they are supposed to be. We need to change that, and therefore we need legally binding measures, more control and conditionality and sanction mechanism that hold national and local authorities accountable. We need to better coordinate our work at national and European level. We need a coordinator at Commission and Parliament. We need to build an inclusion strategy that is worthy of this name and that also effectively combats anti-Gypsyism in the mainstream society. Only this direction will finally improve the situation of Romani people in all important areas of life, including health and housing. And in this sense, let me end my contribution with one explanation that is important to me. It is essential to recognize the minority in its heterogeneity and also its right to self-determination on its name. I am not a Rom. I am not an Ashkali, not a Manush, not a Lowara, but a Sinto. And like the groups just mentioned, I too belong to the Romani minority. Dear ladies and gentlemen, dear friends, thank you for your attention.
Perfect. Oh, thank you very much, Mr. Franz, for sending us that video and for taking the time to record that for us. I think what my main takeaways from Mr. Franz's message was, well, for one, what I think is important is to focus again on the people, on Roma themselves. At the end there, he mentions the heterogeneity of the group. I think this relates very much to the idea of not being too paternalistic in approaches. We talk a lot about Roma inclusion, but it's very important to not try to lift that to a level very too much above them. We really need to work with the people themselves, and I think that's one of the main messages that Mr. Franz also advocates for. The message he gives us also about the Ukraine war shows us again that when crisis arises, Roma tend to be one of the first groups of people who are negatively influenced by that, and I think that's also very important to point out. And then, of course, what he does mention as well is there is still a lot of work to be done. We are all very much aware of that. We are very happy to have somebody like Romeo Franz in the European Parliament because, as you may know, quite recently, a couple of days ago, the plenary actually okayed a number of recommendations for Roma people living in settlements in the European Union. And this is just another example of how there is some progress. It is perhaps a bit slow, but there is progress. And that is really what we are all trying to achieve here. If we can then now move back to the slides, I would like to get started on the presentation of the policy paper. Now that we have sort of set the stage with these two keynotes and with some thoughts in the back of our minds, I would like to talk about what we as the Roma Health Network have been working towards. So just to give you a sort of a background as to how this policy paper came to be, in the past couple of months, the Roma Health Network has been collecting evidence, testimonies, research, really just done by our members themselves. And based on that research, what we have tried to do is to sort of find the blind spots that currently exist in national strategies on health and housing, specifically on Roma inclusion. Now, the result of collecting all of that evidence and in pointing out those blind spots is the policy paper, Roma Health and Housing Filling in the Gaps. Again, there's a link in the chat. Will also be reposted later. But the main thing that we did is, based on those blind spots, we have come up with 6 matching recommendations. So 6 main blind spots were pointed out, and we have matched recommendations to those. It's important to note that obviously this list is not non-exhaustive, or it's not exhaustive, sorry. There are obviously a lot more topics that need to be covered as well if we are to achieve Roma health equity, but these are 6 of the main points that were pointed out as important by our members. Just to quickly take you through them, the first one is the use of indicators on health and housing specifically. And the second point is the health advocacy scheme that we advocate for. Also relates in some to health mediation, for example. Then we have a recommendation specifically on mental health, also a very important topic now. And then two recommendations on housing, specifically one on expansion of the housing plans to combat housing inequalities, but also the health impact of housing. Then the fifth point is also sort of related to housing and to health as well, environmental justice, so environmental inequalities faced by Roma. And then lastly, a more overarching recommendation on lessons that need to be taken from COVID-19. So if we can then move on to the next slide, I would like to get started on the first point, which is about the use of indicators. And this is really, this recommendation is the first for a reason, because a lot of work that is done on Roma inclusion starts with the use of indicators. After all, indicators are a tool that allow you to set a goal, because you cannot really progress unless you know what your goal is and how you're going to get there. And that is where the indicators come in. Now, we identified in the national strategies in particular that the use of key performance indicators or progress indicators, whatever you want to call them, but the use of indicators is lacking quite a bit. Despite the fact that the use of indicators, the importance of that is known to the member states. In 2021, the Council of the European Union released a recommendation. It's also linked there in the presentation for later reference, but in this recommendation, there is already a number of indicators, sort of core indicators that are important to pay attention to when we want to address Roma health, for example, but also Roma housing and all the other sectors as well. And this is very crucial. Unfortunately, not all of these indicators, or really all these focus points of what do you need to pay attention to, are not all included in all of the national strategies. This is not a surprise because there is also a large lack of disaggregated data on Roma issues in general, and this makes it very hard to actually translate these indicators to clear plans. And this is something to keep in mind. Despite that, if you also, for example, look at the graph on the side there, there are some indicators, there is some data, but it's quite limited as it is. There are tools to remedy this. As I said, there is the 2021 Council recommendation that already gives sort of an overview of topics to focus on. But there is also the Fundamental Rights Agency's portfolio of indicators, which focuses specifically on Roma. We will also have some time to speak about this in the panel discussion later on. But another example is also Eurostat's Sustainable Development Goals. And these are all really these give examples already of certain points that can be focused on and that indicators can then be matched to. Using all of these, building an action plan or a strategy around these indicators is the key component, but there should also be a clear goal towards disaggregated data collection on the national level, perhaps also on the local level, but just so member states also set up plans to actually start collecting data to make it even more effective to do these Roma inclusion plans. It's important to point out there that lack of data is not an excuse not to act. Data should be something that complements. It should not be something that qualifies. And this is really also one of the core messages that we want to leave you with. Moving on then to the second point, we talk about the health advocacy scheme. The health advocacy scheme is something that stands really closely to the work that the Roma Health Network does. It's about capacity building, essentially, of Roma and non-Roma civil society. Or pro-Roma civil society. The main goal with this really is to give Roma a voice, to include Roma directly in the solution towards improving their health and towards Roma health equity. And that is also why the Roma Health Network advocates for a community-based approach, so really from the bottom up, going upwards, to really work with the people and place that link with the other levels of government as well. And the main goal with that is to include Roma themselves so that they can advocate for their own needs and that they can participate directly in the solution. So really, in this case, in health solutions. One important thing to point out with that is that that also requires health mediation, so that there needs to be structurally supported health mediation at the structurally supported from the national government. To ensure that access barriers to health for Roma, for example, but also communication with healthcare professionals is facilitated. To do that, you do need also to some degree require intercultural training. And there is a caveat to that, because intercultural training is important to train healthcare professionals, but it is also important to then not do this in a paternalistic way. This needs to be done in a non-paternalistic way, because if you patronize Roma in their access to health, this can have an adverse effect, and that is exactly what you want to avoid. So those are some of the main points to mention within that health advocacy scheme. The main goal with it really is to take away barriers to healthcare for Roma in a non-paternalistic way, as I said, and to give Roma a voice through their own advocacy for their own needs and for participation in the solution. Moving on to the next slide, I would like to talk about mental health. Now, as you might know, mental health is receiving more attention in the European Union. Quite recently, that has been emphasized, for example, also in the State of the Union speech held by Ms. von der Leyen. But in the national strategies, we've noticed quite a lack of focus on mental health. And that is despite the fact that mental health is is crucial for Roma health for one, but it's also a bit of an issue. It is quite a large issue, in fact, and it's also quite latent. It's not very easily spotted. Now, when we talk about Roma health and also about health inequalities in general, we usually talk about what is called the social determinants of health. And really what we mean with that is what is your background? Where are you born? What kind of work do you do? What is your socioeconomic background? Things like that. Now, those same social determinants can also influence mental health. When we spoke with Mental Health Europe, for example, they described this as what is called the psychosocial approach. So really this sort of approach of social determinants to mental health. From the Roma Health Network, we then advocate for what we call a human rights-based approach. So really, you look at these social determinants and you try to address them, aside from just promoting mental health. If Roma face mental ill health, this is also partly caused by these social determinants. And by addressing those social determinants, you can then also improve mental health, and then Roma health in general, of course, as a result. Now, taking that psychosocial or human rights-based approach to mental health, and through addressing those determinants, that can then help to prevent mental ill health among Roma. And we go obviously more in depth on this in the paper as well. Moving on to the next slide, I would like to talk about the topic of housing, which is perhaps not directly related to health at first glance, but it is actually quite crucial also to health outcomes. Now, most of the national strategies do also include a housing strategy, but there are some shortcomings in this as well. For example, in our conversation with FEANSA, another NGO specifically focused on homelessness among Roma, there is a clear lack of focus for Roma suffering from homelessness, as well as halting sites for mobile Roma. These are just two examples, but there are more issues that we know of as well. In general, there is still further expansion necessary on the national housing strategies as well as they pertain to Roma. That is one issue. Another issue that we need to point out that is also shown in the graph on the slide that you can see now, discrimination in housing. When we talk about anti-Gypsyism, so the specific discrimination targeting Roma, it is very clear that this kind of discrimination has a large effect also on housing. If you look at the slide, you can see that the FRA in 2021 showed that about around 46% of Europeans would be uncomfortable with having a Roma as a neighbor. This is just one example, but it sort of sets the scene already for some of the other issues that Roma then also face in housing. What is interesting for us as the Roma Health Network is, of course, what is then the health impact also of those housing issues. If member states use a health impact assessment in their housing strategies, we can figure out what access to utilities or water or dampness in the house, structural integrity of the house, cramped living conditions, what these can have on overall health. And this is really what we try to advocate for. Include also that health impact assessment, so you know exactly what kind of issues exist and what can be, how these can be remedied to ensure that housing is not only that Roma are not just bereft of the right of housing, but it also that it doesn't influence their overall health. And that is part of a holistic approach to expand these housing strategies, but to also immediately start paying attention to other issues such as health, but also perhaps employment and education in this case. Moving on to the next slide, I would like to talk to you about environmental justice or environmental inequalities. This relates also to housing, but also, of course, to some degree to health. Now, environmental inequalities to Roma, again, is also a known issue. But again, in the national strategies, we notice that this receives relatively little attention. I mentioned before that the housing strategies are in place. One thing that is mentioned in there, for example, is access to utilities and water. That is often an issue that is known and that is addressed to some degree. But there are other issues as well in environmental inequalities. For example, segregation or pollution, energy poverty, and even work environment. And these receive markedly less attention in the plans. One thing we do know is that Roma communities often are pushed to the edge. The ERGO network, together with the European Environmental Bureau, has also released a report about this, I believe, 2 years ago, called Push to the Wastelands. And this illustrates quite well that Roma are often pushed to industrial estates or landfills, which obviously have an influence also on health in terms of how there may be pollution there or issues such as that. So that already sort of implies that there are health effects also to environmental inequalities. Now, approaching this, we focus on a topic called environmental justice. So really just justice for, in this case, Roma to have the same access to sort of a good environment and a good environment, just like other people. And it is crucial, in fact, for Roma health equity as well. And that is why we advocate for also a clear plan on environmental justice, to integrate environmental justice either in the health or housing strategies on the national level, or to make a separate strategy for environmental justice, because it is crucial also to combat health inequalities, but also housing inequalities, of course. Moving on to the sixth recommendation, this is more of an overarching global point. It is not gone into we don't really expand on it very in depth in the paper, but it's an overarching goal, and it's something that has been pointed out by our members as being very important. A lot of the strategies, again, here we noticed that there is not a lot of attention for the effects of COVID-19 and for the remedy to issues related to COVID-19. There are some strategies that include COVID-19 vaccination campaigns, but that's really most of the extent of the focus for COVID-19. And this is despite the fact that, as you probably know yourself, COVID-19 has laid bare a lot of inequalities, among them health inequalities faced by Roma. You can think of issues such as difficulty to adhere to lockdown measures because of living conditions, or the fact that they have less access to employment, that they are limited in their employment opportunities. And we have even seen reports of scapegoating, for example, where Roma were blamed for spreading COVID-19, which obviously isn't true, but there were these narratives going around. Now, looking at those issues, what is important for the member states to pay attention to is to ensure a fair recovery, to ensure and to ensure also that resilience is bolstered, that care systems are prepared in case of another one of these pandemics going on or a health crisis going on, that Roma are not the first ones to be negatively impacted by that. And that is why you need to take lessons from these from the effects of COVID-19 to inform strategies so that this can be avoided in the future. And that's really what we advocate for here. It's to take lessons from COVID-19, to let it inform the strategies, and to then ensure a fair recovery for Roma and for other minorities, of course, as well, and to bolster resilience so that Roma in the future are not left behind. Now, I would like to go to the next slide to just conclude this presentation. This is an overview that we have used for our analysis. What you're looking at here is two tables with indicators, and these indicators are based on what I mentioned before, the 2021 Council recommendation. So these are the points of focus that each national strategy should focus on. Now, as you can see, the results are quite mixed. There is not really a very clear sort of green overview of this. And just to sort of explain to you how this works. When there's a green box, that means that an indicator that was in that council recommendation is accounted for in the national strategy, and that it has a clear objective, clear plan related to it, at least to some degree. This is all, again, not exhaustive, so this is not to say that it's for sure going to happen, but that it is at least mentioned. Orange means that the indicator is included in some way, it's mentioned, but there's not very clearly a objective related to it or a plan or strategy. And then red means that it's simply not mentioned at all. Now, with this policy paper, with this event today, what we really want to do is to make a call of action, not just for the European Commission, but more importantly, perhaps for the national national strategies, for the national governments, and perhaps also local governments, to try to make this overview as green as possible, to really cover all of these indicators to ensure that there will be progress in health and in housing. Ideally, we would then also expand this with the recommendations that we've included in this paper. But that's really what we are trying to call for, to really make sure that this is as green as possible, that there is a comprehensive, holistic approach, and that is then a large step forward towards Roma health equity. Now, with that in mind, I would like to move on to the panel discussion, so we can minimize the presentation again and then get started on the panel discussion. So if the panelists would turn on their cameras now. We are joined by 4 speakers. I'm not entirely sure if the 4th one is actually here, but I will. Oh yeah, there I see Kumar is here as well. Perfect. Okay, so we are joined by 4 speakers. We have Jaroslav Kling from the EU Fundamental Rights Agency. He works for the Roma inclusion sector in particular. We have Daniela Miranda from the Center of Community Research and Action at the University of Sevilla, and Olga Theodorikakou from Klimaka NGO in Greece. And these are both Roma Health Network members whose research and whose comments have also contributed to the paper. Then in addition, we also have Kumar Vishwanathan, who is here on behalf of the European Roma Grassroots Organization Network, or ERGO Network, and he also works for his own organization, Vzájemné soužití, or Life Together in Ostrava. Now, just to remind all of the speakers, we would like you to keep your contribution between around 6 to 7 minutes. And again, if anyone in the audience has any questions, please share them in the Q&A function as well. Now, I would like to start first with Jaroslav Kling, the project officer for Equality, Roma, and the Social Rights Unit at the FRA. And he will be speaking to us about some of the FRA's indicator plans for Roma inclusion, and hopefully focusing also on health and housing here. So Jaroslav, the floor is yours.
Thank you, Thomas. Let me go directly to the point. As Marcela Adamova mentioned, the new EU Roma framework sets not only the targets for individual member states, but also defines the monitoring framework for this strategic up to 2030. This strategic framework is in the form of portfolio of headline indicators and secondary indicators. This list of indicators that is being included in this monitoring framework is a result of wide consultation with the national Roma contact point offices, with the civil society organizations. And here I have to thank to ERGO for organizing it or for getting together the civil society organizations for that consultation, but also consultation with the European Commission services. There were several rounds of consultations in 2020, a result of which is the list which we have now published in this portfolio of indicators. One would understand that we cannot make a very long list of indicators that would be used for monitoring, because it would be not implementable. So now we have 17 headline indicators and around, I think, 30 secondary indicators. When it comes to health, the main headline indicator is the life expectancy difference between Roma and the general population. For those who are dealing with statistics, might say that life expectancy is, I would assess it as one of the best outcome indicators that covers not only health, but also housing, because you can't really very strongly influence it directly. It is really showing the effect of variety of policies in the countries. The difficulty with this indicator is that one needs the life tables. And what is the problem with life tables? It means tables of births and deaths, is that they are not usually disaggregated by ethnicity. Hence, we cannot really calculate the life expectancy for Roma from these life tables. We could do some models, and there are examples in different countries modeling based on the life tables, but not many. And then there are some local researches in few localities where they tried to simulate life tables. In FRA, we tried to estimate the life expectancy for Roma based on the sample surveys and inclusion of few questions in our questionnaire when we are interviewing Roma. It is indirect estimation of life expectancy based on the orphanhood method. And currently, what Thomas was showing, the life expectancy calculated for 5 Western European countries for selected Roma groups or subgroups. But recently, also from the Roma Survey 2021, we have this estimated for Czechia, Greece, Spain, Croatia, Hungary, Italy, Portugal, Romania, and Slovakia. When it comes to housing, the headline indicators that were selected also were selected after quite a long discussion, and their main advantage is that they have equivalents for general population. The housing deprivation, overcrowding, those are standard indicators which are used for general population for the general population assessment of housing situation. And the last one, the access to tap water, is somehow doesn't have direct equivalent, but there is a proxy indicator which is collected for general population. When we were narrowing down the list of indicators, we had to somehow exclude, after these discussions from the health area, the indicator on early pregnancies, because somehow, yes, it is an important in a number of countries, important indicator, but then it was somehow considered to be too sensitive for making it possible to have this. And in housing, yes, we didn't have available indicator on residential segregation, which is one of the key issues in EU member states. But this is in making, I would say. If we want to see what are the situation when it comes to health based on the survey data. As I mentioned, we have the life expectancy difference between Roma and general population calculated for a number of countries now, and Marcela Adamova already mentioned, on average, 11 years for women and 9 years for men, the difference between Roma and general population. And this goes quite, this aligns with the earlier estimates and results of the modeling and some local studies. But we also see that the secondary, when it comes to secondary indicators, 2/3 of Roma are assessing their health in general as very good or good. Well, very often, I have to say, we see in some of the countries, they are assessing their health much better than the general population, which goes, I would say, not in line with the actual health status of these people, but the way how Roma are not complaining. And they are taking certain situation. Yes, this is our health, but in general, we are doing well, even if we have some health problems. When it comes to access to health insurance, we see that again, 2/3 of Roma, slightly more than 2/3 of Roma, have access to medical insurance, which hasn't changed since 2016. And also like 15% of Roma have felt discriminated when accessing health services. So we see when we compare 2021 with 2016, that there is not much change in terms of health. One would say, shall we be happy with this or not? When considering that the survey was done during COVID times, I would say let's be happy that the situation was not worse. But of course, we should be maximalist, and we should require that all the effort that was paid in EU member states to the areas of Roma inclusion should bring certain results. So improvement would be desired. When it comes to housing, we see some improvements in Roma housing conditions on average. Yes, there are differences between countries, but on average, there is some improvement. But where we don't see improvement at all is that about a quarter of Roma live in households with environmental problems. And this goes to this environmental justice, or injustice rather. If we see that there is some improvement in terms of housing deprivation, in terms of access to water, access to electricity, to basic amenities, it's improving, yes. And we see huge investments into this area in individual countries. But when it comes to locating the Roma housing close to the environmental hazardous locations, it hasn't changed. And we see that also Roma are facing, a quarter of Roma is facing discrimination when they are looking for housing.
Sorry, Jaroslav, could I ask you to work towards
two last sentences.
Okay, perfect, thank you.
All this data, which I was just quoting, will be officially made available at the end of October in the event which Marcela Adamova mentioned, the European Platform for Roma Inclusion. And you will have basically all headline and secondary indicators available for all countries where we made the survey. And at the moment, also many more indicators is available on our web pages from the two previous Roma surveys, EU MIDIS 2 and Roma and Travelers survey, where you will see also more detailed health and housing related variables. Thank you.
Okay, thank you very much, Jaroslav. I think it's extremely fascinating, and it really shows how sort of difficult of a topic this is, and especially why this is so important to do as well, and why is partly the reason why we also advocate for your work. I just wanted to point out as well that I was very impressed with the work that you did in Bulgaria with the Statistical Institute there. Which was sort of a good step forward towards disaggregated data collection as well. Okay, but now I would like to move on to Daniela Miranda. She's a researcher at the Center of Community Research and Action at the University of Sevilla, as I said. And she's one of the Roma Health Network's founding members and an expert on community-based methodological aspects. And she will speak to us today about health advocacy and the community-based approach. So the floor is yours, Daniela.
Okay, good morning. Thank you, Tomas, and thank you to EPHA and all my colleagues from the Roma Health Network. It's nice to see the policy paper ready to share and disseminate with all our work. So I'm just going to briefly describe a community-based approach to Roma health, but really first looking at what the values are behind that from a Roma health justice approach. And so the reason that we work and promote the health advocacy model is because Roma health and Roma health inequities really reflects the anti-Gypsyism, and it's really an issue of power and privileges and problems when it comes to distribution of resources, which we've heard throughout the morning. Where are the funds going? How are they being distributed? Who's making those decisions? How can we restore the different types of relationships, and as a researcher, the relationships we have with communities. And so Roma health justice approach helps us to be intentional in addressing power dynamics at various levels. So beginning not only with, a lot of times we talk about capacity building and capacity building within the community, but also the interiorized anti-Gypsyism of non-Roma people as well. So a Roma health justice approach lets us provides a lens to really look at the different power dynamics at different levels. On the one hand, disactivating power for some stakeholders, and another activating power for communities. And so what that looks like is being very critical, what's the role of civil society organizations from a health justice approach? Well, it's changing or adapting the service user model to a partnership with communities and providing a space for communities to voice their experiences and their priorities. For policymakers, it's an issue of not only representation of Roma communities at the decision-making table, but that there's real influence behind that. And as a researcher, for example, my personal experience is not working alongside communities is not just a participant research relationship, but actually recognizing community experiences as knowledge and co-creating knowledge together to influence change. So on the one hand, we have a disactivation of power, and another one, the activation of power. So really supporting different Roma communities to tell their stories, tell their experiences, to influence change and gain power. So this is a human rights-based approach. There's a social justice issue, which is really how do you put that into practice? Well, we say that through a community-based or a community-led health advocacy approach, we can really address anti-Gypsyism and the different powers and privileges that are present at various levels. And so advocacy is not only a means to an end, but a means in itself, an end in itself, where it can help communities gain power, at the same time addressing and changing structural nature of health inequities. And so a community health advocacy model puts those principles into action, and we can see it at the individual level, where communities are not only talking about their experiences, but turning it into evidence and feeling heard and recognized, which is a key problem that we see through anti-Gypsyism, is a lack of recognition of different types and different Roma voices. A recent example actually is a colleague, Roma Gitana colleague of mine, who was talking about through the research process, she could really understand that. She said, I've always been told that living like this is my fault. But through advocacy, I was able to see that it's not my fault, that I have a right to live in other types of conditions. So advocacy permits for communities to gain power and to see where different power dynamics lie, and heal the interiorized anti-Gypsyism that also promotes health inequities. This also changes, advocacy allows to change the types of way that people relate to one another. So the different power dynamics that exist, so reorganizing that power and changing the way stakeholders relate to one another, as I previously mentioned. And the aim is to create a supportive environment for communities and to really mobilize resources and in action. And from an advocacy point, this can look like creating a local coalition. For example, right now we're working in a project with Roma adolescent girls with the frame of advocacy. And we have a local coalition of teachers, of family members, of significant adults in their life, researchers, and really creating the right scenario for girls to be able to go to Congress or to Parliament to go advocate for what their dreams and what their priorities are as well. And so advocacy is not only that transformative at the individual level or the way that we relate to one another, but also taking action at the structural level and taking action on issues that matter to the community, and that their voices are heard. And so advocacy is that process where we change the way we relate to one another, explicitly talking about power and privilege, having honest conversation throughout the process, and really using evidence to identify where power lies in everyday life, and taking indicators from the community itself. And I think that's what I have for today. Thank you, Tomas.
Yeah, thank you very much. I should point out as well that because what you're talking about now, obviously in the policy paper, we advocate for this health advocacy scheme, and that's based on, of course, largely on the work that you have done as well. I think the way you describe it now it is very meaningful in that sense, that we're really working towards setting up a blueprint in that sense of that whole advocacy approach. what you point out as well, and that I would like to also hook into again here, is the importance of the form of the local community. And this, of course, differs in every member state in the European Union and outside of it. But that there is that heterogeneity, and that is exactly why, okay, so you want that structured approach on the one hand, but you also want it to be tailored to those specific needs, and to allow, obviously, this is the most important thing that we keep repeating, that Roma are involved themselves in that participation, in that advocacy. So thank you very much for clarifying that even further for us. And also because, you know, even in the policy paper, we try to go in depth on that, but there are other points also to point out that you just made as well. So thank you very much for that, Daniela. Yeah. Okay, with that, we'll move on to Olga Theodorikakou. So just to introduce her as well, she's the head of projects and strategy at Klimaka NGO in Greece. They are a social cooperative for socially included people. They focus a lot also on mental health. They do a lot of work with that. They are also, as I said before, a Roma Health Network member. And so within really that expertise, Olga will be speaking about mental health support and advocacy and interventions during the COVID-19 pandemic. So Olga, the floor is yours.
Thank you, Thomas. Hello from Greece. I would like to thank you not only for this invitation, but also your work in general. Just a small introduction. Klimaka is a not-for-profit, non-governmental organization active in the fields of mental health and social exclusion for more than 25 years. Among other mental health units and programs, Klimaka runs since 2000 the Roma Day Center, which is the only one in Greece. At the center, we provide mental health services with a psychosocial perspective, since the improvement of health and mental health is strongly connected to other determinants such as education, housing, and employment. Klimaka Roma Day Center develops a holistic and integrated approach in order to combat social exclusion and inequalities, providing supporting services in all above mentioned fields. I would also like to add that among our colleagues in Klimaka, more than 50 persons from the Roma community have worked since its establishment, while also people from the community work at the supported by Klimaka social cooperative Klimax Plus. Focusing on mental health, and especially as we are close to the recent World Mental Health Day on October 10th, I think that it's worth mentioning that this year's theme by the World Health Organization is an urgent call for global action in order to prioritize mental health and the combat of its unequal social determinants, since now more than ever, the impact of the growing social and economic inequalities to the progress and well-being of the global population is recognized. At this integrated, holistic approach I referred earlier, speaking about Klimaka's work with the Roma community, mental health care of people coming from generations and generations of exclusion, poverty, marginalization, cannot be anything else but holistic. Not addressing in parallel the socioeconomic conditions in which those people live. Providing services not only in our unit, but also in informal settlements without basic infrastructure, often in hardly habitable dwellings without access to electricity and water, to children born in prison, and to 14-year-old girls that are mothers but don't know how to write. We know that everybody doesn't have equal opportunities to the fundamental right of physical and mental health. The psychosocial approach to mental health is imperative, something that has to be developed as a common field of action of all the relevant statutory initiatives and strategies. More activation and empowerment of those measures and tools that have to do with mental health is demanded, in parallel with those concerning physical health. We have also to identify what has worked until today and what not, on the basis of a rational evaluation and assessment with strong, clear, and intergenerational indicators. Accordingly, the support of the Roma community in order to be active substantially with integrative participatory schemes such as the health advocacy schemes, we think that On the basis of the community approach, these can be catalysts on local level, following skills development and empowerment in the fields of mental health and mediation. We know that people coming from the Roma community working in Climaka, in mental health units, as equal members of scientific groups, many of them for more than 15 years, are multipliers for their communities, not only as positive role models, but also as experience, knowledge, and support providers. Another example is our Roma project, under which services to the young girls and women in pregnancy and maternity situation are provided with the goal of their psychosocial empowerment. We meet these women in their houses, many times in sheds with limited access to water and energy, but we know that those women themselves are bringers of change for their children, their sisters, their daughters. And with this opportunity, I would also like to emphasize on the need to move further and include more Roma women in all aspects of social and political support initiatives, since their role is crucial. A few words regarding our COVID-19 response plan. It included info and awareness campaigns in the Romani language for protection measures and vaccination, disinfection activities in camps and settlements, video or leaflet and poster in Romani language, mapping with drone of dispersed areas and isolated Roma in order no one to be left behind, supplying protective and medical equipment, masks, gloves, water, antiseptics. More than 10,000 Roma were informed and supported through our response plan, many of them in camp settlements where the suggestion to wash your hands was simply a joke. I think this is a strong example also that organizations and the state cannot work without strong alliances with the Roma community, but also taking into consideration the reality of their living conditions with multiple aggravating factors. This reality must also be known to state actors, civil servants, health service providers, through educational programs, trying to ensure that Roma are not facing systemic discrimination. So closing and summarizing, an integrated holistic approach of integration and social cohesion cannot miss on two basic considerations. Firstly, since mental health is recognized as a global and universal priority, the instruments of its promotion should be included in all institutional initiatives across social and political life, education, health, employment. Secondly, in order to work and have progress towards the elimination of the multiple discrimination and inequalities that the Roma community faces, the identification and confrontation with the socioeconomic factors of mental health is demanded on the basis of a rights-based, as it was very well referred before, holistic and activating approach of mental health and well-being. Thank you for your attention. I am at your disposal for further discussion.
Perfect. Thank you very much, Olga. I cannot really go in depth, unfortunately, because we are running out of time. But I just wanted to point out that, for one, it's I think your work is a case in point for the fact that we do need to listen to the community itself and civil society, because you gave us all these very specific examples, and then that has actually been translated into very clear points in our policy paper, which shows exactly why it is so important to listen to people like you who work really quite directly with the communities. And also to hammer home that point that those social determinants, not just for health in general, are important, but also mental health. So again, with sort of a way around, are coming back towards also the importance of health in general there. Okay, so with that, I would like to move on then to Kumar. Kumar is here on behalf of the Ergo Network, as I mentioned before. But he also is the director of the Vzájemné soužití organization, Life Together in Ostrava. Now, you will be reflecting on our paper a bit more from the Ergo perspective, but also from the perspective of your own work as well. So without further ado, Kumar, the floor is yours.
Thank you, Tom. It's a great privilege to be here on behalf of Ergo. I'm sure Amana from Ergo is also somewhere here, and I'm grateful to her as well. I think the report should be on the website, so I wouldn't go much into the details because I see that it's quite similar to what you, Tom, mentioned. We have a lot of similarities in what we see, except for the fact that I see two of your tables on housing determinants and health determinants. For the Czech Republic, a bit too green. In reality, I think it's not so green, considering the fact that you see in the Czech Republic, the Roma men have an average lifespan of 19 years lesser than that of the majority. 19. I believe Yaroslav mentioned the average is something 9 years lesser or 10, but we have 19, and the women, they are 17 years lesser lifespan, which is terrible. So definitely there is some discrepancy in the tables that we have, which shows that everything to be a bit too rosy. I mean green. Now I've been working with the Roma here in this town for 25 years. The day before yesterday, we had our anniversary, 25 years. And in the beginning then, it was a time when a lot of Roma from the Czech Republic were emigrating to Britain and asking for asylum. And the British would say, no, you can't get asylum because you have excellent teeth. You could not have been discriminated if you have had this access to dental health. But now when we have summer camps, I see how the children have absolutely ruinous teeth. They see there is no primary preventive care. And what happens is that they go to emergencies to get the teeth removed. So a lot of children at the age of 14, 15 do lack molars and a lot of teeth. This is a terrible thing. And in the past, they used to have preventive checking in schools. You see, I think we have to maybe recommend that such school-based health dentist, services should be provided, because otherwise we are having these children with, we are having a lot of people growing up with hardly any teeth. It's terrible. Now, housing, we mentioned housing as a big problem. In our city of Ostrava, around 80% of the Roma live in ghettos. Stressful conditions, which also play a role on the health. They pay extreme rents in such houses. The houses are very poor heat insulation, so they spend a lot on heating, and then they cannot afford it, and so homelessness happens. Last week, we got a mother with a 10-week-old child from a forest living with homeless people. A lot of mothers are giving up their children voluntarily to institutional care. This is also terrible because we have been fighting all along for deinstitutionalization of care, and now we have a surge of families giving their children to institutions to take care because they cannot afford to feed the children, to provide them with housing. Basically, housing is the problem, and we still do not have any law on social housing. Gentrification is a huge problem in our town. Roma are being removed from localities where they used to traditionally live. And we have a big problem presently with the Swedish enormous multinational company called Heimstaden, which has bought 30,000 flats in our city and is basically carrying on gentrification, kicking out people to invest, and so that the richer people can afford these flats. So where do the poor go? That is a big problem. Now, our study was based on, we had questionnaires, we questioned 400 people. So we discovered that, for example, in spite of being a very we have a good social health insurance in this country, but still we found that 20% of the Roma don't have health insurance. We find that many people complain of anti-Gypsyism from hospital people. Yeah, we stress the importance of Roma health mediators. They should be from the Roma community, who can inform the people of taking preventive measures, going for regular health checkups, etc. This should be done by the Roma. And also, the hospital authorities don't have much idea of the Roma, so there's unnecessary conflicts. We have maternity wards where Roma women give birth separately from the non-Roma women. And it humiliates the Roma women to be treated so differently. It happens in 21st century Czech Republic in Ostrava, the hospital of EPHA. So, a lot of things we have in common in our reports, but I would like to mention one more thing, which is not in any of our reports. It's about, Daniela mentioned about community health advocacy. We have been, for 18 years, we've been doing this for the justice for women who are forcibly sterilized. And we take it as a health issue also, apart from a human rights issue. And after 18 years, they won this battle in a sense that the parliament has passed this law on compensation. But then we have, I'm complaining now because the government is dragging its feet. The women, recently we had another funeral of one of our fighting women who passed away. There's no justice, these are elderly women, and the justice and the system is so slow, dragging its feet. So we are looking at ways of putting pressure. There is also the question of informed consent. You see, the doctors don't really treat the Roma patients, and generally, people with the respect they need. You see, they think they know best, and the old Hippocratic oath, but it's nothing to do with modern medicine. In modern medicine, unlike in the Hippocratic oath, you don't just do good for the person, but you also communicate with the person, get the person's consent. Now, that is a big problem we feel in this country, and sterilization is just a sharp example of this problem in our country, of the doctors thinking they know what is best, and often they deny Roma families. Many women say with children, if you have many children, the doctors just deny you services. Yeah, that kind of humiliation. So apart from, anti-Gypsyism, so we agree on certain things. For example, housing is a big problem. Gentrification is a big problem. No social housing. Insurance coverage, there is a big problem in it. 20% of the people are not insured. Healthcare facilities like dentists, etc., are not accessible. We want them to be in schools. We think they should be in schools. They should come back to the schools. Preventive care. There should be Roma health mediators, which is very important. Then we think that anti-Gypsyism in healthcare should be addressed, and the paternalism and the I know best kind of approach of doctors should be challenged. I think these are the main conclusions from our side.
Perfect. Thank you very much, Kumar. For one, the last points you made, I'm very happy for you to kind of give us that overview of the things where we overlap. I'm also very happy that actually that you mentioned about that overview, that it is indeed too green. I fully agree. And I didn't mention it in the presentation, but it's important to point it out. Yeah, it is green, but green doesn't mean that we're done and it's good. It just means that it's in the plan. But something being in the plan doesn't necessarily mean that it's going to happen. But at least it means that there is some awareness about it. But that still means that we have a lot of work to do as well.
I thank you for that table, so we can challenge it.
Yeah, exactly. Yeah. No, that's exactly what we're trying to work towards, I guess, in that sense. Yeah, to have this knowledge to some degree written down, so we can challenge it. Indeed. Yeah. Also, actually, I would like to also take the opportunity now to sort of point out that the Ergo Network is in fact working on its own synthesis report. So that will be, I believe, released shortly about health and long-term care, and it's based on those national case studies of which one is, believe, what you talked about just now. So I would like to just have that mentioned, so for people to also keep an eye out for that. Now we are running out of time a little bit, but I would like to just briefly go through the Q&A, and we can perhaps take just 5 minutes for that. So just let's see, I have one comment actually from somebody who said that there is research work on prevention for the Roma ethnic community in Slovenia. I'm happy that's mentioned. We have actually a member in the Roma Health Network who is active in Slovenia, so we are very much aware of that. So thank you for pointing that out. Then we have, let's see, Amanda Sutherland, who mentions that she works with a Roma community in Rotherham in the UK, that the houses are in very poor state of repair and Romas are exploited and pay high rent. So this relates to what, what Kumar was talking about earlier. And that's, again, also, yeah, dentistry is a problem there as well. So that just to sort of, illustrate that those issues exist across the board. And then we have one person, Genoveva Sotirova, who has shared a lot of questions with us, but I would just like to take one of them. I believe she's Roma herself, and she has an example of her mother needing medical treatment, but that's because of sort of systemic racism, I guess, in the healthcare system, it's very difficult for her to access it. So I was just wondering if anyone of the panelists would perhaps like to talk about that specific topic a bit, because it's not necessarily covered very extensively in the paper, but it's about systemic racism and sort of discrimination in the healthcare system. If somebody has perhaps thoughts on that or an example or something, just raise your hand, I guess. Daniela?
Yes, I wanted to mention also in relation to Kumar's presentation as well. I think going back to the role of a health justice approach, when we're thinking of barriers, and health mediation is a good mechanism to bridge the barrier, but not necessarily change anything. And it kind of goes back to what Kumar was saying, when there's medical practices and professionals who have discriminatory attitudes and practices, that there has to be work done to intentionally and address that, while at the same time and in parallel implementing mechanisms to address those barriers immediately, for example, health mediation. But that doesn't promise long-term change or a change in health professionals' attitudes towards Roma. So the work has to be done, training and making spaces for professionals to really address those attitudes.
Thank you. I see both Olga and Kumar have something to add to that as well. So I think Olga had her hand up first. So you go ahead, Olga. You're muted, Olga, if you can unmute yourself.
Sorry. I also refer to systemic discrimination and the need, as Daniela said, for training programs for health professionals, social professionals, civil servants, etc. Another practice we have also suggested many years ago is the inclusion of members of the community in state services, for example, with an employment status, so that they can act more, in a more active way in their environments where this systemic discrimination takes place, so that they can also have not only a mediation role, but also be encouraged to have their role as members of state services, etc.
Thank you for that clarification. Kumar, you put your hand up, but did you? Okay, so I would just like to briefly also allow Jaroslav, if you have maybe some last points you wanted to make, also related to this point, and then after that I would like to briefly go through some more questions and then conclude.
Not necessarily on this point, but on this coloring table, which also you presented at the end and Kumar was commenting on. I think with the publication of the communication on Roma inclusion by the Commission by the end of the year, which Marcela Adamova mentioned, we will see similar coloring of the member states, what they promised to do. And as we were discussing, Kumar, earlier this year when we visited Ostrava, yes, the strategy is nice. It addresses the key issues which we have, but let's see if the strategy will be also implemented. So even though it might seem that in Czechia the strategy has all its elements. Let's see what will be there at the end, whether we see any improvements in the area of health and housing for Roma.
Thank you, Jaroslav. That's actually a very nice sort of addition. I'm happy that that table actually does bring some of these points to surface as well. I will. Oh, sorry. I see Andrei also wants to speak briefly. Andrei Ivanov, just to introduce, he's also from the FRA, he's the head of the sector that Jaroslav works in. So Andrei, please go ahead, but try to keep it within around 3 minutes per sure.
No, definitely I'll be less. Thank you very much. Very briefly, I wanted to comment on two things. Thank you all of you for this interesting session. On several occasions, Roma local activities were mentioned, local networks. And I want to remind, again, this COVID period. We did a summary research on the impact of COVID on Roma communities. And one of the very, I would say, striking but not surprising findings was not the fact that Roma are disproportionately affected by health risks and related, not health. For example, prejudice, somebody mentioned that often they were perceived as spreading the virus. But on a positive note, the role of local health mediators, which basically were the first line of response. Why I'm mentioning this? Because this is important, but also risky. On the one hand, Roma health mediators play a very important role beyond the health sector. They're basically working and serving as field workers, social field workers. But on the other hand, there is a risk that governments would be very happy to just discharge their responsibilities and move subcontract or whatever you name it, responsibilities in provision of health services to all citizens as Roma citizens of these states, to NGOs or informal networks or health mediator networks. So there should be a very important balance kept in mind. On the one hand, securing the participation of Roma through these health networks, which is also, by the way, a very important career perspective, learning perspective. But on the other hand, not decreasing and not blurring, diluting the responsibilities of the government in that respect. And last comment, you mentioned, Thomas, the Bulgarian project and the data collection which we supported. This is really important endeavor, not so much because of the data, but because of the national ownership. And this is something which we want to support in the future, so that the national governments take over the data collection and the responsibility for acting once data is there. You would be surprised how different is the perception of the data when it is produced by some agency sitting in Vienna, like Fundamental Rights Agency, and when it is done by the National Statistical Institute with a national expert, with their field workers. And really, it is important. Hopefully, it will trigger certain effects for their own, not just producing, but using the data. But let's wait and see. I'm optimistic. Thank you very much.
Thank you very much for that, Andrei. I'm sorry, I cannot really respond to your points in depth because we need to move towards the conclusion. And there was one more comment I just wanted to address in the Q&A, which is from Mariana Frontera, who works for Corge in Ireland. We're also a Roma Health Network member. And she also mentioned just very briefly that in Ireland, there are currently no actions on Roma and accommodation in the National Traveller and Roma Inclusion Strategy, which is a large problem. I mean, especially in Ireland, we know, because Ireland currently doesn't really have an active Roma inclusion strategy ongoing, at least not that one that we could find. So just thank you very much for that comment as well, Mariana, to kind of point that out. There is another comment, but I'm afraid we're going to have to conclude because it's already, we're going over time. So I just want to really briefly thank all the speakers again today, also Marcela Adamova and Romeo Franz for their contributions earlier in the event. And really, sort of with this, we hope that with this event and with this paper, that we have managed to to give you an overview of what is necessary, what are the necessary next steps. And this is just the start of answering that question of what are the next steps towards Roma health equity in general. But I think we have managed to get a very nice overall view of like some of the different levels, you know, at the European institutional level, but also at the community level and somewhere in between. So really that's sort of the main thought that I want to leave with today, is that I hope this, for a lot of people, also for the participants, is kind of a way of showing what are the next steps forward towards Roma health equity. What do we need to do to get there? So again, thank you very much for attending today. Have a great day, everyone, and see you next time.